Hello and good afternoon. Today I'll be presenting an intervention plan for Jesse Pinkman, a fictional client from the series Breaking Bad, as part of my social work substance use assessment class. We'll look at Jesse's substance use history, mental health, recommended level of care, and a comprehensive treatment plan tailored to Jesse's needs. Jesse is a 25-year-old Caucasian male living alone in Albuquerque, New Mexico. He primarily uses methamphetamine, but also uses alcohol, cannabis, and ecstasy. His use is daily, with binge episodes tied to stress. He experiences withdrawal symptoms like fatigue, depression, and aggression. Jesse also struggles with depression, anxiety, hallucinations, poor nutrition, and poor sleep habits. He has limited support system and often masks his insecurities with humor. Given these factors, the recommended level of ASAM care is 3.5, which is a clinically managed high-intensity residential services. The treatment plan is based on ASAM's level 3.5 and includes several interventions. Individual therapy will use DBT-informed CBT to address emotional dysregulation, guilt, and impulsivity, as well as trauma-informed care for underlying emotional pain and identity issues. Family therapy is not recommended at this time due to Jesse's limited contact and unresolved trauma related to his family. Group therapy will focus on substance use recovery, DBT skills, and psychoeducation on relapse prevention and emotional regulation. Community resources are essential for Jesse's recovery. He'll be connected to peer recovery groups like NA, nutrition and wellness programs, and vocational rehab or job readiness services. The time frame and aftercare, Jesse will participate in a 90-day residential program with weekly individual and group sessions. There will be monthly reassessment and discharge planning. Aftercare includes stepping down to ASAM level 2.1 intensive outpatient with continued DBT group and individual therapy, ongoing peer support, and case management. The SMART goals and objectives that are outlined for Jesse are goal 1 is to reduce methamphetamine use and prevent relapse. So Jesse will attend 3 DBT group sessions per week for 12 weeks, identify 3 personal triggers, develop a written relapse plan within 30 days, and maintain 100% compliance with random drug screens. Jesse will take random drug screens twice weekly and maintain 100% compliance for 12 weeks. Goal 2 is Jesse will improve emotional regulation and reduce depressive symptoms. So the objectives are Jesse will use mindfulness and distress tolerance skills, which he will track via journal entries for 8 consecutive weeks. And Jesse will report a 50% reduction in depressive symptoms measured by the PHQ-9 by week 10 of treatment. And then goal 3 is Jesse will develop healthy coping skills and life structure. So Jesse will engage in skills training like stress management, emotional regulation. Jesse will complete 6 skills training modules within 8 weeks. Jesse will create a structured daily schedule with staff support, and then Jesse will develop and implement that schedule within 5 days of admission, and that schedule will be reviewed weekly. The cultural considerations and responsiveness. Cultural considerations are important. Jesse's identity as a white male may afford him some systemic advantages in accessing treatment and avoiding legal consequences. However, his involvement in illegal drug production has placed him in situations where others exert their control over him, and that it diminishes his autonomy. The plan aims to restore Jesse's personal power by building emotional regulation skills and supporting his own decision making. And Jesse also faces social stigma and marginalization, due to his substance use and mental health symptoms. The treatment plan incorporates DBT, which is effective for emotional dysregulation and trauma. Jesse's humor and non-traditional lifestyle will be acknowledged during therapy to build rapport, and peer support groups will be selected to reflect Jesse's age and lived experience, helping him connect with others who understand his background. Here's just a few more of those cultural responsiveness points that I just was talking about. And then here is my references page. The reference for this plan does include the DSM-5, and also it has research on substance use treatment and motivational interviewing as well. Thank you for your attention, and I appreciate you listening.